Hi everyone, welcome to this revision session for Principles of Exercise. So the purpose of today's session is really to give you a little bit of a refresher on the knowledge that you picked up during your time learning on the on-screen learning platform, specifically on the Principles of Exercise. Now, as you'll know, this is one of your multiple choice exams. So the aim really is just to sort of cement some of that knowledge that you've been picking up and just give you a better chance of passing your multiple choice exam. Now, obviously, because this is a pre-recorded session, there won't be sort of any interaction with me. But if you're on the live session tomorrow or later on in the week, you've got plenty of chance to ask me any questions and to sort of do some quizzes with me as well. However, so if you're watching this, obviously you're not going to be on the live sessions. And if you do have any questions at all, please just send me an email and I will get back to you and follow up with that. But I will also send this PowerPoint out to you and you can keep this for revision purposes as well. Okay, first of all, the multiple choice exam. So the multiple choice exam is 60 minutes long. Now, if you've got any additional learning needs, such as dyslexia or anything like that, just reach out to me because we can get you some extra support, get you some extra time doing that exam. So if that sounds like that might be something that you need, again, just drop me an email and I will arrange that for you. So it's 60 minutes. It's, as you know, a multiple choice exam and there's 40 questions and it's a 50% pass mark. Now, I'm feeling quite confident that I can get you all through that. 50% is I feel quite a low number for, and previous awarding organisations I've worked with, it's been as high as 75. So I think if we need 20 questions right to get you through this exam, and I feel quite confident with the multiple choice exam that we can get you through that. Now, a few little tips, and you've probably heard all these before, but if there's a question that you're not sure of, feel free to move on and come back to it. Also, if there's a question you're not quite sure of, a lot of the time, and I'm going to give you some example questions during this session today, but a lot of the time you can work out through process of elimination. So have a little look and sometimes you can rule out two straight away that you know it definitely isn't. And then you can sort of work around the remaining two to see if you can come up with an answer. So that's a little tip that I'd give you. Move on where possible if you're not sure, but also try and eliminate ones that you know it's not correct. So I'm just going to skip that one as that's an interactive session. Right, let's get straight on to the components of fitness then. So not to be confused with skill related. So these are more health related components of fitness. And they are known as muscular strength, muscular endurance, cardiovascular or cardiovascular fitness, you might see it, flexibility, and motor skills. Now, if you think of anyone that you're going to work with in the gym, they will probably do some form of this type of training. So whether it be muscular strength or muscular endurance, cardiovascular type training, flexibility. Now, motor skills is a little bit more along the lines of if you think about coordination, balance, working efficiently in them types of movement. And then we have skill related components of fitness. So the skill related components of fitness are speed, power, reaction time, coordination, balance, and agility. Now, if you think about the typical person that you're going to work with in the gym, you might work on their balance, you might work on their coordination and reaction time, especially if you're working with maybe a special populations group like an elderly adult, and you want to sort of prevent the risk of falls. So they might be things you'd work on. You definitely work on these components if you're working with any sort of athlete or somebody that wants to just improve in any sort of general sporting activity. So think along them lines of when you're taking these sort of skills or developing these skills with real life members in the gym. Now, with exercise, there are going to be short-term effects, things that happen immediately, And there's going to be long-term effects. So further down the line, if you're consistently exercising, there's going to be further effects. Now, these are the short-term and long-term effects to the cardiorespiratory system or cardiovascular system. So think about, and I'm not going to read all of these and bore you to death, but a few things like in the short term, if you start running, for example, straight away, you know that your heart rate is going to increase. Blood's going to be pumped around the body faster. Muscles are going to demand more oxygen. Obviously, as you start running, your breathing rate is going to increase. Stroke volume increases. The amount of blood pumped around the body will go up. And then a few other things with the blood vessels and blood pressure. And then longer term effects, think about things such as your resting heart rate is going to come down because your body becomes more efficient at working. Some things that are quite relevant to members: reduce blood pressure. So that's one thing that we always want to work with people to reduce their blood pressure, especially again in older populations. So long-term effects of cardiovascular training is going to be decreasing blood pressure, reduce body fat potentially, depending on calories and other their calorie input. Decrease depression. So it's been shown that exercise improves mood and feeling good, so it can decrease depression over long term. So yeah, and we're going to do the same again now for the effects on the muscular system. So if you think about when we're doing any sort of resistance training or weight training, the immediate short-term effects, potentially they could be something called DOMS, which stands for delayed onset muscle soreness. And there's another slide on that in a minute. There immediately could be muscle inflammation, vasodilation of muscles. We've got the increased temperature of muscles, so they get warmer obviously as we exercise. And then, like the last one, our muscles demand greater oxygen straight away to work. And then over the long term, we've got the typical ones you'd think of. So an increase of strength, increase of size, power, hypertrophy, which is just building muscle. Strengthen tendons as well, which sort of gets missed off quite a lot. So we also strengthen your tendons, and also your ligaments around your bones. Improve posture and muscle balance. Increase metabolic rates, how the processes in the body function, how efficiently and how quickly they function, such as digestion and respiratory work. And yeah, again, I'm not going to go through every one, but you can have a read of them in your own time. So I touched on it there. So we've got delayed onset muscle soreness. Now there's a little question there. Obviously, this is not the interactive session, so you obviously know what that means now. But typically, anyone that's done any sort of weight training will know what this feels like. It normally comes on the day after, but mainly the day after that, so 2 days after normally, but it can be up to 72 hours after exercise. There's just that sore feeling in the muscles. And basically, it's just micro tears in the muscle fibers from the exercise or the weights lifted. And obviously, the heavier the weight or the more intense the weight or the exercise, the greater amount of soreness that you'll get over the 72 hours. It's important to point out as well, this may have come up in your online learning platform, but there's a couple of different types of contractions. So we have concentric, eccentric, and isometric contractions. Concentric is where your muscle shortens. So let me go through all first. So eccentric is when your muscle lengthens, and then isometric is when it doesn't change length at all. So if we think of something typical like a dumbbell curl, so picture this now, standing with your arm fully extended, dumbbell in your hand. As you lift and raise that dumbbell in the curling motion, that's a concentric contraction because your muscle's shortened. As we lengthen that and drop it back down, that's an eccentric contraction. Now, DOMS occurs with any type of contraction, but it's thought to be more severe or more severe on the eccentric phase. So for example, if you was to do something like eccentric training, which focuses more on the eccentric movement, again, thinking of a dumbbell curl, if you're lowering that down a lot slower, so you start at the top of the movement, so your dumbbell's up near your shoulder, and you're slowly dropping that down, doing the actions for you here at home, slowly lowering it down in the eccentric phase, and then you quickly straight back up to that starting point and slowly lowering it down. That's more of an eccentric style of training, and you're bound to get a little bit sorer from that style of training. So I just thought I'd add that in there for you, because it may come a question where it asks you what causes more DOMs out of eccentric and concentric. Okay, let's move on to the next one. So the effects of exercise on the skeletal system now. So short-term effects. So we've got increased synovial fluid, pliability. So that's sort of the fluid inside your joints. Increased joint lubrication. Again, same thing. So it can take more wear, if you like, and it becomes more lubricant. Long-term effects. So it becomes more efficient, the fluid. Less mobility exercise is required. So as you strengthen your skeletal system, less mobility exercises may be required. It's kind of debatable, I'd say, that one, because mobility is still important. Increased mobility and range of movement. So that's a big one. So around the joint, there'll be an increased range of movement around that joint. Greater stability in the joint, which is always important, especially for any sort of sporting activities or athletes. Strengthen the ligaments and tendons, as I touched on before. Reduce risk of injury and strengthening of bones, and also reduce risk of osteoporosis. So the last sort of three there, I suppose the last three are important for anyone, but the last three more important for elderly clients if you're working with anyone in the special populations group over 55s. Okay, let's touch on blood pressure now. So blood pressure, we've got two types. So the systolic and diastolic. So systolic, that is the bigger number that you'll see. So normally if you see something like 120 over 80, so 120 will be the systolic number. And that is the contracting and pumping phase of the cardiac cycle. So as your heart beats, that is the pressure it generates. Now, diastolic is when it relaxes or not rests as such, but sort of refills. So when the heart is refilling in between them contractions, that's known as your diastolic. And the normal range, typically you'll see 120 over 80 being ideal, but anything just below that, either of them is fine as well. People are known to have high blood pressure or hypertension when it goes from 140 to 90 plus. Okay, so that is blood pressure. Sticking with the topic of blood, but not relating to pressure now, there's a thing called blood pooling. Now, when you exercise, and if you suddenly stop exercising, there's a chance that the blood can sort of build up in your lower, mainly in your legs, so in your lower extremities. This can cause sort of dizziness. It can cause you to feel a bit sick, maybe a little bit faint. If you've ever trained anyone, or even if you've trained yourself and you've got like suddenly felt really sick or just a bit dizzy or a bit blurry, it could be from blood pooling. And if you notice, or if you see this happening with anyone that you're working with, a really simple thing to do is lie them flat on the back, elevate their legs. So just put their legs on like a step box or a bench, and it feels like magic. If it is something like this, blood pooling, give it 10 seconds and that person suddenly just comes straight back round and a lot more alert. And that's just because the blood's allowing to flow back down to the heart, to the head, and start working more efficiently. And again, to get the blood flowing fully around the body. And as it says there, so we have arteries and veins, as you'll know, and we'll cover that a bit more in the anatomy one. But arteries are a lot stronger, so they force the blood around the body, so they take it around the body, whereas veins return it. So veins don't have the same amount of strength as arteries do. So yeah, so without assistance from the muscles, the extra blood then just starts to sort of build up in the muscle in the lower legs. And question there, so what can we do to reduce this? Again, this was going to be a question to you guys, but things we can do to reduce this are make sure that we cool down after sessions. So rather than instantly stop exercising, make sure we cool down. And also at the start, it's really important that we warm up. So rather than just going straight into bang intense exercise, we're gradually building that heart rate up, getting it up to a stable level, and then we can move on to the main session. After you've cooled down at the end of a session, another good thing is to have a little stretch off as well. That can also help. Okay, so we're going to move on to the principles and variables of fitness in an exercise program. Before we touch on them, it's important to mention the SAID principle because this may come up. So the SAID principle stands for specific adaptation to imposed demands. So if you think of this in a practical sense, our body will adapt to anything that we put it through. So that's when people thinking of terms of lifting weights now, when people sort of get to a certain, let's think of a bench press as an example exercise. If we constantly just do 20 kilogram bench press, we're never going to get stronger than that. So what we need to do is place some more demands on our body by increasing that weight. If we increase that weight, our body will then adapt to that heavier weight, if that makes sense. So if we then start doing, I don't know, sets of 25, our body will adapt to that. It'll get stronger, it'll develop. And then again, we need to follow the SAID principle again if we want to continue to progress, and we progress by adding a bit more weight. So that is it. So our body adapts to what our training demands. Now, there's a few different areas of an exercise program that we can look at. So we've got specificity, we've got progressive overload, we've got reversibility, adaptability, individuality, recovery time, frequency, intensity, time, and type, or type and time. I'm going to go through the bottom four on another slide, but just to take you through, first of all, starting from specificity. Hate saying that word. So with this one, basically all it means is if we have a client or a member that comes in, we have to make sure that whatever we're giving them exercise wise is specific to what they want to achieve. So if you've got someone that comes into you and they want to get as strong as possible because later down the line they're going to do a strongman competition, really random example, but there you go. Are we going to be doing an hour a day on a treadmill, doing intervals? Definitely not, because that's not specific to what they want to do. So we need to make sure that our programs are specific to that person's goal. We need to make sure that we're following progressive overload, and progressive overload is kind of what I just mentioned in the SAID principle. So we want to make sure that our program is progressing over time. And that doesn't necessarily mean we have to increase the weights every time, or it's the weights that have to go up. Think of other things that could go up. So you could potentially do more sets with somebody. You could potentially do more reps with somebody. You could give them less recovery time in between sets. If they're doing more cardiovascular type training, you could do that for longer. You could do longer intervals. You could do shorter rest in between intervals. So just something that's making that session and the sessions over a period of time more difficult for that client. And by doing that, they're going to be following the SAID principle. And just to relate this back to your practical session, which is for your assessment at the end of this 6 weeks or in the last week, you want to make sure, if you've read the guidance I sent out yesterday, you're going to be planning 4 gym programs, and you need to show that them 4 programs are steadily progressing. So whether that is like I just mentioned, an extra set in there, whether you're just going to add extra weight in there, less recovery time. So just think about how you can progress it and make things harder. Reversibility. Now, what reversibility is, if I've been training for, let's say, 4 weeks, then I suddenly stop training. In 4 weeks' time, I'm going to have regressed. So I'm going to have started to lose some form of fitness, depending obviously what style of training I'm doing. So if I'm doing more resistance and weight training, I'm probably not going to be as strong in the next 4 weeks. I mean, it could take a little bit longer than 4 weeks to lose ultimate strength, but down the line, if you stop training 6 weeks, reversibility is sort of going backwards, if that makes sense. So rather than progressing, you're sort of regressing because you're not doing the movements or the exercises. Adaptability now. So our body, very similar to the SAID principle again, our body will adapt to what we put onto it. So in order to get better or improve, we need to follow point number 2, progressive overload, to adapt to that given weight, and our body will continually adapt as we put more demands onto it. Individuality is very similar to specificity, so it needs to be individually planned to that client, and that doesn't mean necessarily just based on their goals. That could be based on their height, their weight, their sort of physical attributes in the sense of how flexible they are, how much training experience they have. So if I have a client that comes into me that's never used a gym before, am I going to put them on the same style of program as somebody that's training to go to the Olympics? 100% not. It needs to be individual to that person, and it needs to be at their level. And then recovery time. So we need to take into account the recovery time that client may need. First of all, in between sets during the session, but also over the weeks and the months. So if you've got, again, using that same example, if I've got a client that has never used a gym before and a client that's an athlete, the athlete could be training 6, maybe 5, 6, 7 times a week. That client that's never used a gym before might start on 1 session a week, might start on 2 sessions a week. And it's important, let's say, for example, we put them on 2 sessions a week. We're probably not going to put them on Monday, Tuesday. We might put them on a Monday and a Friday and have days in between. So think about that as recovery time for when you work with real life clients. And as I say, the frequency, intensity, type, and time, I'm going to cover in this next slide, I believe, if I remember right. Yeah, so the FIT principle. And a question to you guys was going to be, what does it stand for? So we know that now. So it stands for frequency, intensity, type, and time. And this is just another thing to think about when you're planning programs. So this will help you, because there'll be questions about this on the multiple choice exam, the reason why I'm going through it now. But this will also help you to do and plan your practical sessions and 4 practical plans that you've got to do for your assessment. This will help you plan them and also help you plan future programs for clients or members in the gym. So think about frequencies, how many sessions a week they're going to be doing. Intensity is basically how intense is it going to be? How much weight are you going to use on a movement? Are you looking at getting the heart rate into particular areas? Are you working them, for example, at 80% of their maximum heart rate, which I'm going to cover in a little bit? Are you looking at the total volume, which is reps, sets times reps times weight, gives you the volume. So how intense is it going to be? What type of training are you going to be doing? Is it strength? Is it endurance, muscular endurance? Is it cardiovascular endurance? Is it more flexibility type training? And how long are the sessions going to be? So think about the client you're working with. Think about that individuality thing again. Is the client only going to be able to manage 30 minutes and 10 to 15 minutes of that is a warm-up? Are they that basic to start with? Or is that client quite experienced and you need longer sessions? You can get an intense session within an hour, but if it's an athlete, which obviously I don't think any of you are going to be working with at this stage, but it's good to think about and compare the two. Athletes could be working a couple of hours a day, multiple times a day. So yeah, it's good to think about that as the principle, as the FIT principle. So here are a couple of typical exams that you might exam questions that you might get on the FIT principle. Now this is taken from one of the past papers. So which component of the FIT principle should be manipulated first to ensure overload of training? So should it be frequency? Should it be intensity? Should it be type or time? Just give you a few little seconds to think of that. Pause it now if you want to have a little go at this. The answer is intensity. So, and what I mean by that is, if you've got a client that has just started training with you and they're training, let's say, twice a week. Now, week one, they do the 2 sessions that you've planned, fine. Now, week 2, are you necessarily straight away going to start adding on extra sessions? Or would you potentially just look at the sessions you've just done and make them a little bit more challenging by maybe adding weights or maybe adding more time to their time spent on a treadmill? So think of that. So you're going to make that session more intense first, and that's what that is. So you'll increase the intensity before you start looking at how long you spend in the gym or how many times you spend in the gym or the type of training. You just make things a bit harder by adding a bit of weight, don't you? Okay, next question. When doing home-based exercises, which component of FIT principle will most likely require modification? This is quite fitting, actually, obviously, with lockdowns we've been through and stuff. So have a little think of that. Again, pause it if you want to work that out. A type, then you are correct, because just think about it, you are going to be limited to what you've got. So when you're doing home-based workouts, you're not necessarily going to be able to keep increasing the intensity because you might have a restriction on the amount of weights you've got. I mean, obviously, to a point, we can still increase the intensity. We can change things around. But first thing you're going to do or take into consideration is the type of training you're going to do and what the client has available. So I hope that makes sense. So there's 2 example questions, and there's going to be other questions throughout this presentation that some more examples. Next part, we're going to go on to monitoring exercise intensity. So when we work with clients or members, we need to know how hard they're working. Now, there's a few different ways that we can do this. First one, and the most simple one, is the TORQ test. So if you've not heard of the TORQ test, it's just basically speaking to your client as they're exercising. Now, if you're having a conversation with a client while they're exercising, straight away, this gives you a bit of an indication based off the way they're talking back to you. So if they're working at a moderate level, so they should still be able to comfortably hold a conversation with only mild breathlessness towards the end of sentences. If they're able to speak comfortably with no breathlessness whatsoever, then you know for a fact the intensity is too low. So you need to change it. Like I say, unless it's something like a warm up or a cool down. If they're only able to speak a couple of words and really don't want to talk, you will know these people that just don't want to talk to you. Then you know that they're working at high intensity. If you get someone on a treadmill and they are doing interval training and they are running for 20 seconds flat out, they should not be able to have a conversation with you in them 20 seconds. They should be working as hard as possible. So what this is, to TORQ test, is just a really quick and easy way of you to get a gauge on how hard that client is working. Now, the pros of this is obviously there's no equipment needed. It's really easy to explain. You wouldn't really explain this to a client, actually. It's really easy to understand, I should say. And you're able to use it without the client even knowing. So if you can use this to your advantage, you can have a little chat with a client, and if they're just chatting back to you, you know, for example, that they're not working hard enough. You need to push them a little bit more. And the cons of this, obviously, it's unreliable. You're not going to get detailed data back from them. You're just getting a little bit of a gauge, and it's subjective. it's sort of your interpretation. That person could struggle talking, even just doing light exercise. So it's not the most accurate. The next one we have, and the one that you'll use during your session, so during your practical video that you're going to record, this is the one that you're going to use, and it's the RPE scale. And the only time you need to use this really is during the warm-up, where you want to get your client to a level 5. During the main cardiovascular part of the session, where you want to get your client 7+. And then during the cool down session, where the aim is your client should normally be around 5 or 4, and you want to gradually drop their heart rate back down, or their level back down. And just to give you a little bit of an explanation of what it is, so it shows you obviously there from the image. I always work from a scale of 1 to 10. You can use 0 to 10. When you're working with a client, they're not going to be at 0 because they're going to be doing something. So I always use 1 to 10, but feel free to use 0 if you want. If you think of 1 being, this is how I explain it to people, and you can use this example in your session as well. Think about number 1. You've literally just opened your eyes, you've just woke up, you've sat up out of bed. You are at a level 1 there. There's no intensity going on in your life whatsoever, apart from a little stretch and a yawn. Number 10 is the opposite end to that scale. You are flat out running. I've always heard this example as well, running for your life. So imagine there's a tiger chasing you. You are running for your life. You cannot possibly go put any more effort into your exercise. And that would be number 10. And the purpose of the RPE scale, which stands for rate of perceived exertion, is how the client perceives how hard they're working. So at various times during the session, you will just say, tell me on a scale of 1 to 10, how hard this exercise is, or how you're feeling. And they might say, sometimes they might say, yeah, I feel fine. If they say that, get a number. So get a number so you can quantify it, because it's very common just to say, yeah, I feel fine. Oh, no, it's hard. Get an actual number of 1 to 10, because that helps you gauge better then. And this scale that I've put on here for you breaks it down into different areas. So you've got very weak, very, very weak, should I say. You've got weak, moderate, somewhat strong, strong, very strong, and very, very strong. It's up to you how you interpret this. The pros to this, again, there's no equipment needed. It's very easy to explain to your client. So what you will do on your assessment at the start, I'm going to monitor it. I'm going to monitor you using the RPE scale. So at various points during the session, I'm going to ask you on a scale of 1 to 10 how you're feeling. The scale is number 1, imagine you've just got out of bed. Number 10, working as flat out as hard as you can, like you're getting chased, like you're running from your life and getting chased by a tiger. So I want you to tell me through various times of the session where you are on that scale. That's how you'd explain it to a client. So really easy to explain, and easy to understand for the client. Like I say, the only thing you might need to do is just prompt them to get an actual number from them sometimes. Cons. So the cons to this, again, it's not the most accurate. It's their perceived, so as the name says, it's their perceived exertion level. It's subjective. It's what they think. Again, kind of the same thing. And also, and this is not to be sexist, but this is mainly to us men, it's very common for us to underreport. So if you've got a macho guy that wants to lift as heavy as possible, he might do his 1 rep max and say, yeah, it's about 5, because he don't want to look like it's too hard for him. So yeah, so ego may play a part when you get in them scores. And if that's the case, you just make that exercise a little bit harder, and then you soon see that ego dwindle away when they're then responding 8, 9, 10 levels to you. Okay, next one is heart rate. So we can train people based off their heart rate. To get a gauge of what their maximum heart rate is, an estimated calculation is 220 minus their age. And that gives you a rough guideline of what their maximum heart rate is. But allow 11 beats either side of this error, because like I said, it is an estimate, it's not bang on. I know recently in my spin class, top of my head, I should be able to do this quick maths, but I think my maximum heart rate 187, something like that. I've gone over that in spin. I've got in the 190s. Now that could be that my tracker's not that accurate, or it could be that my maximum heart rate isn't actually what is calculated on this estimate. Now, if you want to work somebody, let's say, at a certain percentage of their maximum heart rate, if it's 50%, you're just going to multiply their maximum heart rate by 0.5. A little bit of percentages reminder for you here for maths. And if you want to work somebody at 80%, a 28-year-old, here's your example. So it's 220 minus your age, which in this case is 28. So 220 minus 28 gives you 192. And then 192 multiplied by 0.85, you want to get your client to around 163 beats per minute to be training them at 85% of their maximum. Now, to do any of this, we need to have some sort of monitor on them. So whether that be a heart rate monitor, a chest strap that goes around the front, whether you're working based off their Apple Watch or their fitness tracker on the wrist, it just depends, but you need some sort of kit. So the pros to this, it's the most accurate method we have. It's easy once you've set up with the client, and it gives you a better understanding of how hard or how not hard the client is working. So you could have been working with a client doing a certain exercise or a certain group of exercises, and they could have been telling you on the RPE scale they're working at a 10. Then the next week you bang a heart rate monitor on them and they're at 100 beats per minute and they're in the 20s, and you're like, so they were sort of overestimating how hard they were actually working. So it's a good way to see how hard or how not hard they're working. The cons to it are it may be expensive. Now, they're not too bad now. I think you can get a heart rate monitor, just one of the chest straps. I think you can get one for about 20 to 30 quid now. Obviously, the dearer, the better models are a little bit dearer. You're probably looking at 50 plus. Most people now will have a wrist watch that sort of tracks their heart rate. Now, the only issue with these are they're not as accurate as a chest strap. So if you're training a client using heart rate and they're using the wrist strap, it gives you a gauge, doesn't give you 100% accuracy. To be fair, a chest strap doesn't give you 100% accuracy, but it gives you more accurate readings. So yeah, just be aware of that. And also what I've noticed working with clients as well is if they've got a watch on or a wrist on, sometimes it can take 10 to 15 seconds to sort of catch up. So if you do, let's say you do something like, I don't know, burpees, and you get them to do 30 seconds worth of burpees, when them 30 seconds are up, if you get them to instantly check their watch, sometimes it might take 10 seconds for it to sort of click in and it'll shoot right up. And that's just the sort of the wrist watch trying to read and catch up. And then the other cons is not everyone's going to have access to a monitor. So if you end up doing this full time, this job as a fitness instructor and moving on as a personal trainer, you might just want to invest in a chest strap and borrow that to clients if you plan on using heart rate training. Okay. The next bit I'm going to take you on is special populations. Now, again, this is very text heavy, so I'm not going to go through everything with you, but there are a few. There is a section in the exam where they'll talk about special populations. So we've got older adults, we've got disabled, we've got younger adults. There's one more on top of my head. We will go through it and it'll come back to me. But yeah, so there's going to be questions on special populations groups and training with them. Pre and postnatal women, that's the other special population group. Now, it's just important to understand sort of more the safety considerations of and your sort of limitations as a fitness instructor. So I'm not going to read through all of these for you because it's, again, you can read through these yourself. But these are the main ones that you want to consider. So what is your duty of care to older adults? What are your limitations as a fitness instructor? And what sort of adaptations can you do? So these are the things that you've got to try and understand, because these sort of types of groups, you're not necessarily going to be working with these full time. But let's work through this one. So the duty of care for older adults, you need to ensure that the client is aware that you only hold a basic knowledge for the special populations group, which is covered in this course. Now, if they want to work maybe personal training with someone, obviously you need to be a level 3 personal trainer, but ideally you should also have an extra qualification in working with that special populations group. Don't prejudge that all elderly clients have the same medical conditions. Believe me, there's some 50+ people that I have trained that are a lot fitter than some 20-odd people that I've trained. So don't straight away think that that person isn't capable of doing something. And ensure, as always, with any person you work with, let alone special populations, ensure that a PAR-Q is completed and investigate conditions further. So if you get a client, if you're going to do an induction on the gym floor and they've completed a PAR-Q and they've said that they've got, I don't know, let's say joint issues, for example, go out and investigate what potentially you could look at to help that client. So do you need to, if it's a knee joint injury, are they going to be limited to certain exercises they can do? Probably. But is there certain exercises you can do that can help that? Definitely. Things like maybe like a leg extension to build the quad. Don't want to ramble here going on into too much detail, but yeah, just basically further investigate and see how you can help that person. Now, limitations to your role. So do not advertise as a specialist in the subject without a recognised specialist qualification. Hopefully you won't do that, but make sure you've got a qualification if you're gonna say you're a specialist in that area. Any medication clients are on that you don't know the potential side effects for, make sure that, first of all, make sure they've got a doctor's note to say that they can exercise, and do a little bit of research on that. Or if you don't feel comfortable, pass that client on to another member of staff that you know is qualified in that area. Most people will have an exercise referral scheme. Most gyms will have an exercise referral scheme or a member of staff that is exercise referral qualified. So you might need to pass it on to them. Exercise adaptation. So with this special population group, you might do a longer, more gradual warm up and a longer cool down. Remember them too, because that's one of the example questions. Emphasis on coaching points. So you might really give them a bit more coaching. Ensure good technique. That goes without saying for any person. Reduce the range of motion. So if they are struggling to do a full depth squat, you might just, it doesn't mean they can't do squats. You might put a bench behind them and just get them sitting down to the bench and standing up like a box squat. Extended rest periods. So you just give them a little bit longer between sets, a little bit longer to recover. You might reduce the intensity, whether it be weight or time or effort, and you might provide more stability. And yeah, a good example of that is what I've just mentioned about a box squat. So you might just add a box behind so they've got something to sit on. You might make that even easier by getting them to hold a TRX and sit down onto the box. So they've got a bit more stability again by holding the TRX. Let's move on to pre and postnatal now. So the general effects of pregnancy include increased heart rate, increased stroke volume, increased cardiac output, should I say, and increased oxygen uptake. Now, different things happen through each trimester and then post-birth, but you can have a read through them in your own time. Again, this is the bit we really want to concentrate on. So the duty of care. So we need to ensure the welfare of mother and pre-born/newly born baby. Again, hopefully that goes without saying. We need to be alert for any contraindications towards exercise and refer client to a midwife or GP. So make sure that if you don't feel comfortable working with that client, that you refer them on, or if you feel like it's a little bit out of your scope of practice, just refer that on. If advising this population group, you need to hold an appropriate qualification. So if you can give basic advice to this person, but it's ideal, it's more ideal if they go to a person that's got the pre-postnatal qualification or anti-postnatal qualification. I think it's a level 3 qualification. Limitations as a fitness instructor. So your level 2 qualification doesn't qualify you to work with this special population group. So again, general conversation with the client, you can advise to your scope of practice, but if they want to work with you or get a program for you, you really need to refer this person on. And that's exactly what the next point says. Again, there's a few adaptations there, a few things to avoid. So when you're giving this general advice, just in passing comments, you might just want to bear some of these things in mind, like avoiding supine exercises after 16 weeks, avoid prone lying, which you'd expect. But a lot of people don't understand the supine thing after 16 weeks. So yeah, there's a few different things to be aware of. The next special population group is the disabled. So if you're going to work with a disabled person, it depends, again, what that disability is. So every participant should be offered an equal opportunity. So don't straight away judge that person and think that they're not capable of doing something. Give them an equal opportunity. Do not discriminate against them. The Equality Act is in place to ensure that service providers have made reasonable adjustments so accessible to disabled users. So your gym should all be accessible for disabled users, whether that's a ramp at the door or push buttons to get through the main doors, whatever. There'll be some sort of thing in place for you to access disabled access, should I say. Limitations. So a standard level 2 instructor is not qualified to specialize in this field and shouldn't advertise as a subject specialist. So again, like your older adults, you can give advice, you can work with this person, but you can't specialize and say that you specialize in that area if you haven't done further qualifications. Medical problems should be referred to a qualified exercise referral consultant. So if they've got medical issues and you feel like that person would be better suited with somebody that is exercise referral qualified, then please pass them on and refer them on. If expected to work with this group in the long term, a qualification should be obtained. Hopefully, if you find that you are getting a lot of these types of clients, then I'm sure that you'd go on and do your exercise referral qualification. Exercise adaptations. So obviously you're going to need to learn more about the disability. Different disabilities affect people in different ways. If we've got a wheelchair user, for example, there is no restrictions. There's potentially no restrictions in upper body strength whatsoever. So you might just adapt and just work maybe upper body sessions. But yeah, depends on the disability. Simplify exercises where possible. Break down movements, reduce intensity levels, encourage slower moves. Again, this all just depends on that person and what they're capable of. But there's a few general guidelines. And then finally, we've got young people. So there might be quite a few of these within your centres. So with these people, it's just important that there's a greater risk of growth plate fractures just to bones not being fully developed. And this occurs most commonly between 14 and 16 years old in boys and 11 to 13-year-old in girls. This doesn't mean that they can't do resistance training. That this was quite a big misconception, especially when I did my qualification years and years ago. It was straight away, you can't do this style of training. However, you can do resistance style of training. What you want to avoid is really super heavy types of exercise and really high impact stuff. And just be careful in your centres as well. You might have certain limitations. I know the last gym that I worked at, 14 to 16-year-olds could use resistance machines such as a seated chest press, a lat pull down, leg press, but they couldn't use free weights. And the thought behind that, I think, from the company that I work for, was probably more can go wrong with free weights. There's less sort of stability. There's more things that can go wrong. But yeah, check your company's risk assessment or speak to your duty manager and find out what your policies are. So to avoid then growth plate fractures, so you want to avoid excessive training. You want to consider gender differences and stages of development. So think about how old they are. It depends how young these people are that can use your facilities. Avoid inappropriate size matching in activities. So this is more sporting related. So if you're organising, I don't know, a football game or a rugby game or something where there's a bit of what's the word? Contact. If it's a contact sport, consider matching sizes. So you're not going to put a group of really tall, built younger people against shorter, not as built or not as developed people. So try and match them up if that's part of your role. Avoid static high impact activities and use appropriate equipment. Again, just look at the style of training that you're going to do. You can do circuit training, but you probably want to avoid them high impact stuff. There we go. Okay, duty of care for young people then. So ensure parent or guardian has provided permission and completed the correct PARQ screening form relevant to that young person. Hopefully by the time that they're meeting you and they've come through the gym doors and you're doing a program or an induction with them, hopefully I think that all has been done and it'll just be a case of you checking over that PARQ. Ensure the client is safe while using the facilities and not at risk of abuse from others. So think about your safeguarding of that child when they're with you with that hour, or even within the centre in general. It's your job to safeguard and look after them people in your facilities. Limitations. So if you're working regularly one-to-one with a child, it's advised that you get a children's fitness qualification. And avoid lone working and physical contact where possible. Try and work in an open environment, open to the public, just again to prevent any sort of accusations of abuse and safeguard yourself really, as well as that young person. Adaptations then. So avoid overstretching. Limb length can be disproportionate, altering biomechanics. So yeah, just be careful that you're not overstretching. Yeah, because it can be quite flexible. Younger people, a lot more than us older people as we develop. They can be less coordinated and they can have a lack of balance. So just take that into consideration with the exercises that you're recommending them. Think about using more stability type stuff. So rather than doing things on maybe a fit ball, you might do it on a fixed bench, depending what you're doing with that person. Closer supervision to ensure good technique, again, goes without saying for anyone. Free weights, better choice if performed correctly, as smaller increments. Now that's an interesting one because, as I mentioned, my past place wouldn't allow free weights, but I can understand the reason what they're saying on here. So you can go up with small increments. So sometimes dumbbells can go up in 1 kilograms. So you've got more control over that. So I suppose it depends on your fixed machines, how quickly their increments go up. But yeah, like I say, you need to check your company's policy with that. And they're less able to control body temperature. So it's important that you make that young person hydrated, get them to carry water around with them because they can overheat. So typical exam questions on the special populations group. Which of the following should be avoided when programming exercise for 14 to 16-year-olds? So should we avoid high intensity intervals? Should we avoid maximal weights lifting? Should we avoid circuit training? Or should we avoid aerobic intervals? Now, going back to that last slide, quite misleading because, where was it? The one before. Avoid static high impact activities. Whereas the exam is allowing you, let me give you the like, pause it there. Now you've had a guess. It was maximal weightlifting, but let me go back to what I was saying. So in the slideshow, it says avoid high intensity, high impact activities. Now, high intensity intervals, this is from the official exam, this one. High intensity intervals are fine. Circuit training is fine. And aerobic intervals are fine. So when it's talking about high impact stuff, it's talking about the high impact in the weights lifted. So anything that's sort of cardiovascular base is fine. Think about avoiding going too heavy. So sort of any sort of like weightlifting exercises or any sort of power lifting exercises you're going to avoid, and just monitor that weight selection. I hope that makes sense. And it's just to prevent the growth plates from damaging, and also to ensure that good technique is performed. Another question. When working with mature adults, so think about 50 plus, a key safety guideline would be to shorten warm up and cool down, only lengthen warm up, only shorten cool down, or lengthen warm up and cool down. What is the answer to that? I'll let you pause it if you want to work it out. And hopefully I'll give you a little reminder before, or a little inclination that this was coming up. You want to lengthen the warm up and cool down. So just extend your warm up. So if you might warm up for 5 minutes, double that to 10 minutes. Again, judge it based off your RPE scale. But if you warm up, you're aiming to get them about a 5 on that RPE scale. Guys, that takes us to the end of the revision session. So I've just touched on the principles of exercise there. Now, in your learning, your online learning materials, you will have obviously a few more things to read through. I'll just stop sharing my screen. So you'll have a few more things to read through. There'll be a few more areas, but they are the majority of the areas that will be covered. Obviously, there's 40 questions, so there's going to be more things coming up. But have a read through this. I'm going to have a watch through this, obviously. Again, if you need to, read the PowerPoint slides that I'm going to send out to you, because you can keep them. And then just continue working through your online learning platform. Just revisit each area which you feel like you need a bit more support in. But like I said, 50% pass rate is not a bad pass rate. So I think we can get you through that. So we need 20 questions right, and I think we can do it. So if you've got any questions on anything at all that I've covered, please reach out to me, send me an email, and I will get back to you straight away and help you out. If you've got any more questions, look out on anything other than the exams, come into one of the drop-in sessions, and hopefully I will see you in the anatomy live revision session. If not, again, I will pre-record one so you can follow along like you have with this one. So that takes us up to almost an hour. So I'm going to end the recording there. Thanks for listening, everyone, and I'll speak to you all soon.